Namaste Bitiya, Hamisha Khush Raho Bitiya. A very good morning to you all. Myself, JV and Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine and Faculty of Homeopathic Science at JAYOTI VIDYAPEETH Women's University, Jaipur. In this series of lectures, we have been discussing about the various diseases that are related to the adrenal gland. Till now, we have discussed about various diseases, like we have discussed about the diseases due to the excess of the hyperaldosteronism. We have discussed about the Cushing's syndrome. We have discussed about pheochromocytoma. We have discussed about the various other diseases that are related to the adrenal gland dysfunction in the past few lectures. Today, we are going to discuss with another important disease that is also important from the examination point of view. And this is related to the hypofunctioning of the adrenal gland. The name of the disease is Addison's disease. We have already discussed about Cushing's syndrome. So the relation of Addison's disease with Cushing's syndrome and its comparison will also be discussed today in this lecture. And these are the two topics, like Cushing's syndrome and Addison's disease are the two important topics that are frequently asked in the examination. So let's start with the Cushing's syndrome. Cushing's syndrome we have already discussed. Let's start with the Addison's disease and its comparison with the Cushing's syndrome. What is Addison's disease? Addison's disease occurs when greater than 90% of the adrenal tissue is destroyed. So if the adrenal tissue is destroyed, then the hormones that are normally produced by adrenal are also becomes deficient. So Addison's disease is a very important disease that is associated with the destruction of the adrenal gland or the adrenal tissue. Now, what are the different causes that are responsible for the destruction of the adrenal tissue? The causes includes the polyglandular autoimmune syndrome. So we have polyglandular autoimmune syndromes. We have tuberculosis. There are other granulomatous diseases like histoplasmosis, coccidomycosis, cryptococcicosis, and sarcoidosis. Other diseases includes bilateral adrenalectomy, bilateral tumor metastasis. We have bilateral hemorrhage with cytomegalovirus, HIV virus, amyloidosis, and congenital diseases. So Addison's disease is occurring when the adrenal tissue is destroyed. The causes for the adrenal tissue destruction includes the polyglandular autoimmune syndromes. We have tuberculosis, other granulomatous diseases, which includes histoplasmosis, coccidomycosis, cryptococcicosis, sarcoidosis, etc. It can also be seen in the cases of bilateral adrenalectomy because of some or the other tumor or the cancerous condition. Bilateral tumor metastasis, if any other tumor cells are metastasizing to the adrenal gland and they are destroying the adrenal tissue. Bilateral hemorrhage can be the cause that is leading to the destruction of the adrenal tissue. And other viral infections like cytomegalovirus, HIV virus, amyloidosis, and congenital diseases are also responsible for the development of the Addison's disease. Now, what is the pathogenesis? Pathogenesis for the development of Addison's disease. Now, in the pathogenesis, increased secretion of ACTH. So there is increased secretion of ACTH takes place because of the lowered cortisol level. And due to the increased level of ACTH production, it acts directly on the melanocytes, causing pigmentation of the skin and hair. So because the adrenal gland is destroyed, the adrenal tissue is destroyed, there is a decreased production of the cortisol. So because of the feedback mechanism and decreased level of the cortisol, ACTH is produced at a greater level. Now, the increased concentration of ACTH is responsible for the increased pigmentation through the melanocytes on the skin and the hair. So we have lowered cortisol level that causes increased ACTH level, and it causes pigmentation on the skins and hairs. Now, deficiency of adrenal cortical secretions. This can be of the following types, or it can lead to the following things. So we know we have aldosterone, we have androgens, and we have cortisol. So deficiency of each one of the following is responsible for certain disease condition. So what is happening when the deficiency of each one of aldosterone, androgen, and cortisol is there. We are going to discuss them one by one. Because of the aldosterone, the deficiency of the aldosterone, there will be the conditions like hypotension. So the patient will be having low blood pressure. There will be decreased sodium, potassium retention, and marked acidosis. So the patient with the adrenal cortical secretion deficiency, the aldosterone will be deficient. If the aldosterone is deficient, then it will lead to the hypotension, that is decreased blood pressure, decreased sodium and potassium retention with marked acidosis. The second condition is the androgen deficiency. If there is a deficiency of the androgen, then this will lead to the loss of the pubic hair and axillary hairs in the females. Now, if the androgens are deficient, there will be loss of pubic and axillary hairs in the females, and also there will be loss of the muscle mass, weakness, and loss of libido. So because of the deficient androgen, there is loss of pubic hair, axillary hair. There is in the females, there is loss of muscle mass, weakness, and loss of libido. Now, what happens when there is deficiency of the cortisol? Deficiency of cortisol will cause weakness and anorexia with nausea and vomiting. So there will be weakness, there will be anorexia, that is no desire to eat in the individual, and this will also produce nausea and vomiting. So if the cortisol is deficient, it will lead to weakness, anorexia, nausea and vomiting. There will also be complaints of hypoglycemia with inadequate water diuresis. So we have aldosterone deficiency that will produce hypotension, decreased sodium potassium retention, and marked acidosis. Androgen deficiency will produce loss of pubic and axillary hairs in the females with loss of muscle mass, weakness, and loss of libido. The cortisol deficiency will lead to the weakness of and anorexia with nausea and vomiting, hypoglycemia, and inadequate water diuresis. Now, what are the clinical features with which a patient can present to us with the case of Addison's disease? So, in the clinical features, there are a lot of changes that we can see, as I have just now discussed with you, that because of the deficient adrenal hormones, there will be, or the deficient cortisol, there is increased ACTH, and this ACTH is acting on the melanocytes, leading to the increased pigmentation of the skin. Now, this pigmentation is developing slowly and steadily. There is pigmentation on the skin and the mucous membrane. So you will find the pigmentation present on the skin and the mucous membrane. There will be bluish discoloration with brownish patches or streaks on the lips, gums, inside of the cheek, and posterior aspect of the palate. So in the pigmentation, you will find bluish and blackish discoloration of the skin with brownish patches on the or streaks on the lips. There can be streaks on the gums and inside of the cheeks and posterior aspect of the palate. There will be hyperpigmentation of the extensor surface. There will be pressure points and scars, example, face, neck, dorsum of hands and knuckles, etc. There will be areas of vitiligo or leukodermic type of pigmentation. So there is not only hyperpigmentation, but you can also see the patches of hyperpigmentation, that is known as leukoderma or vitiligo. I have given the pictures of all these conditions in the e-notes. So you can see the photographs in order to understand the changes that I have been talking about in this lecture. There are also symptoms related to the other systems, which includes the GI system, gastrointestinal system, where you will be seeing nausea and vomiting in the patient. And because of the deficiency of the salts, there will be craving for salt, and there will be abdominal pain that is observed in the individual. In the cardiovascular system, there will be postural hypotension. So the patient can have postural hypotension with faintness and heart sound as feeble. So in the GI system, we have nausea and vomiting. There is salt craving and abdominal pain. On the cardiovascular system, there will be postural hypotension, faintness, heart sound is feeble. In the muscular system, there is muscular weakness and wasting. Sometimes cramps are observed. So on the GI system, there will be nausea and vomiting with salt craving and abdominal pain. In the cardiovascular system, there will be postural hypotension, faintness, and heart sound is feeble. In the muscular system, there is muscular weakness and wasting with sometimes cramps. The mental and nervous system will include lassitude and muscle weakness with loss of memory, drowsiness, period of irritability, and insomnia. In the genital system, there will be impotence and amenorrhea. So the patient will complain of impotency and the amenorrhea. And there are certain miscellaneous system that is getting involved that will lead to the development of subnormal temperature, the loss of body hairs on the axilla and the pubic area in females. So we have symptoms related to the GI system, nausea and vomiting, cardiovascular system. We have postural hypotension and faintness with feeble heart sound. There is the symptoms of muscular system that includes muscular weakness and wasting, mental and nervous system, which includes lassitude and muscle weakness, genital system, which includes impotence and amenorrhea, and miscellaneous that is related to the subnormal temperature and loss of body hairs in the axilla and the pubic region. Other systems are also related in case of autoimmune diseases, which includes vitiligo. There can be thyroiditis, pernicious anemia, and IDDM, that is insulin-dependent diabetes mellitus. So with Addison's disease, we can also see the other autoimmune diseases, which includes the vitiligo, thyroiditis, pernicious anemia, and IDDM, etc. Now, what are the clinical features? Clinical features, there are certain clinical features with which the patient can present in the case of Addison's disease. So we have discussed the symptoms related to the various systems, but what are the signs and symptoms? The few signs and symptoms are common that I've already discussed, but there will be few more symptoms that can be present in case of Addison's disease. So the clinical feature will include fatigue. The patient can be very much tired and fatigued. There can be weakness. The patient can be very much weak. So there is tiredness, fatigue, weakness. There can be anorexia, nausea, and vomiting. So the patient can complain of anorexia, that is loss of appetite. There can be nausea and vomiting with weight loss. So the patient can have fatigue, there is weakness, anorexia, nausea and vomiting with weight loss. There can be abdominal pain. That is, the patient can complain of pain abdomen with cutaneous and mucosal pigmentation. There can be pigmentation on the cutaneous surface and the mucosal surface. There can be salt craving, the craving for salt, and hypotension, that is a reduced blood pressure, that is especially orthostatic. Occasional hypoglycemia can be seen in the individuals, and serum sodium level is reduced and serum potassium level is increased. There is extracellular fluid depletion that accentuates hypertension. So the sign and symptoms includes fatigue. We can have fatigue in the patient. There can be weakness, anorexia, that is no desire to eat with nausea and vomiting. There can be weight loss, abdominal pain. There can be cutaneous and mucosal pigmentation with salt craving. Hypotension can be there, that is especially orthostatic. Occasional hypoglycemia can be seen, and serum sodium is reduced and potassium level is increased. There is extracellular fluid depletion that accentuates the hypotension. Secondary adrenocortical insufficiency can be seen due to the primary or hypothalamic diseases, such as tumors. We have infarction, trauma, granuloma, and necrosis. So there are various secondary adrenocortical insufficiency symptoms, means adrenocortical deficiency that is not related to the adrenal gland itself, but other systems due to the primary, due to the pituitary gland or the hypothalamic diseases. So if there is any disease in the pituitary or the hypothalamus that is responsible for the decreased adrenal gland hormone secretion, then it can lead to the development of secondary adrenocortical insufficiency. The diseases like tumors, we can have infarctions, there can be trauma, granuloma, or necrosis. So because of the pituitary or hypothalamic diseases, such as tumors, infarction, granuloma, and trauma, and necrosis, secondary adrenocortical insufficiency can be seen. There can be signs and symptoms. These are identical to the Addison's disease, except for the absence of pigmentation. So there are different signs and symptoms. These are identical to the Addison's disease, except the absence of pigmentation. So in case of secondary adrenocortical insufficiency, you will get all the signs and symptoms that we have discussed, like fatigue, anorexia, nausea, vomiting, pain, abdomen, etc. But there will be no pigmentation because there is excess of ACTH is not present. The features associated with hypertension are unusual since aldosterone secretion is maintained despite of the absence of ACTH. Now, how to diagnose a case of Addison's disease? So for the diagnosis of case of Addison's disease, we need to check the plasma cortisol level. So plasma cortisol level has to be checked for, and it is measured at 9 a.m. If the level is less than 550 nanomole per liter. So at 9 a.m., if the level of plasma cortisol is less than 50 nanomole per liter, it will confirm the diagnosis. The plasma ACTH level greater than 80 nanogram per liter The radiography of the abdomen will reveal the calcified adrenal tuberculous disease. On the chest, it will show tuberculous lesions or the malignancy. Adrenal autoantibodies are detected in 55% of the patients. So for the diagnosis, we can check for the plasma cortisol level that is measured at 9 a.m. and it should be less than 50 nanomole per liter. Plasma ACTH level greater than 80 nanogram per liter. Radiography of the abdomen that will reveal calcified adrenal tuberculous disease. Chest, radiography of the chest will show tuberculous lesions or malignancy, and adrenal autoantibodies are detected in 55% of the patient. Now, how to manage a case of the Addison's disease? So for the management of Addison's disease, because we know that the hormones are deficient, so cortisone or glucocorticoid substitution is the treatment of choice. Aldosterone substitution. So whatever is deficient, we have to substitute it from the outside. Salt is given in addition. 3 to 6 grams of salt intake daily is given to the individual. So this was all about Addison's disease. Now we are going to compare some of the features of the Addison's and a brief revision of the Cushing syndrome. So in case of Cushing syndrome, we have discussed there was thinning of the scalp here, there was emotional instability, acne, moon face, there was increased facial hair with buffalo hump. We had osteoporosis, cardiac hypertrophy with hypertension, adrenal hyperplasia was there, and truncal obesity was there, stria, easy bruising, muscle wasting, and weakness and thin extremities was there with diabetes mellitus. On the contrary, in the Addison's disease, we have different type of personality changes. There is anorexia, nausea, and vomiting that we have discussed. There is hyperpigmentation of the skin. All right, so we have hyperpigmentation due to melanin. There is cardiac insufficiency and hypotension. So in Cushing syndrome, there was hypertension. Here we have hypotension. In the case of Addison's disease, we have adrenal atrophy, whereas in the Cushing syndrome, there was adrenal hyperplasia or the tumor. So in Addison's disease, the adrenal atrophy can be due to the autoimmune causes, infections, or tumor metastasis. There are the symptoms of diarrhea and abdominal pain in Addison's disease, and there is muscle weakness. On the contrary, in the Cushing disease, Cushing syndrome, there was muscle wasting, whereas in Addison's disease, we have muscle weakness. So this was all about the comparison of Addison's disease and Cushing syndrome. Now I believe you all have understood about the Cushing syndrome. You have also understood about the Addison's disease, and Addison's disease is complete to you, and you have completely understood the exact pathophysiology and the mechanism of Addison's disease. So this is an important topic and frequently asked in the examination. So it's your homework to go through the book and to complete the topic, and also prepare the homeopathic therapeutics for both Cushing syndrome and the Addison's disease. So this was all for today. This session is powered by digital version 2.0 JAYOTI VIDYAPEETH Women's University. I hope you have understood the session properly. If you have any query, please mention in the comment box and I'll try to resolve it. So this was all for today. Thank you very much. Have a good day.